Thank you, Mr. Chairman. I'd like to start out by saying that my bill, H.R. 2576, is about fairness. This summer, when the Associated Press first reported that President Obama's health care law would allow middle-class Americans to become eligible for Medicaid, I was shocked. The Affordable Care Act's new income formula that determines eligibility for government subsidies health insurance, the Modified Adjusted Gross Income, or otherwise called MAGI, deviated from all other federal assistance programs, failing to include Social Security benefits as income. Allow me to repeat that. The Affordable Care Act's income formula for Medicaid, CHIP, and exchange subsidies deviated from the eligibility requirements for all other federal assistance programs. Supplemental Social Security income, supplemental nutritional assistance programs, or otherwise known as food stamps, temporary assistance for needy families, low-income energy assistance program, and public housing all include the entire Social Security benefit as income. Under the Democrats' health care law, a married couple with an annual income of $64,000 could qualify to receive Medicaid benefits. Let me put it in more stark terms. Changing the income formula would result in individuals whose income are up to 425% of the poverty level receive Medicaid. This is unacceptable. I very strongly believe that it is our duty to ensure the very scarce Medicaid resources are there for those in most need. And Mr. Chairman, I not only am one who thinks so. At the July the 14th Budget Committee hearing, I asked Richard Foster, Center for Medicare and Medicaid Services Chief Actuary, about the income eligibility issue, and he said, I quote, "I don't generally comment on the pros and cons of policy, but that just doesn't make sense." Additionally, Richard Sorian, the HHS Assistant Secretary for Public Affairs, conceded that, and I quote, "As a matter of law, some middle-income Americans may be receiving coverage through Medicaid, which is meant to serve only the neediest Americans." This legislation that we are marking up today has bipartisan support. In the Senate, Help Committee Ranking Member Mike Enzi has a companion bill, and Democrat Senator Ben Nelson of Nebraska has similar legislation. President Obama himself recognized the problem, and in his recent debt reduction plan explicitly proposes that the entire amount of Social Security benefits be included in the definition of income. This bipartisan solution would bring Medicaid back into line with all other federal assistance programs and ensure that the program is there for those who have the most need. Furthermore, according to CBO and JTC estimates, this bill would save taxpayers an approximate $13 billion over 10 years. Considering our $14 trillion in national debt, closing this loophole as soon as possible is good policy on a number of levels. Thank you, Mr. Chairman. I yield back.